Hello, and thank you for joining us. Joining me today is Susan Love, who is president of the Susan Love Research Foundation and also a clinical professor of surgery at UCLA. And it's really a pleasure to have you here, Sue. You have done so much to move the field. And I wanted to start off by asking you a question that, of course, is weighing on everybody's mind. And this is early detection. Clearly, early detection is critical to improving outcomes, yet there are many avenues for early detection, from imaging to some of the newer techniques. Where do you see the field going, and where do you see the biggest impact coming from?
I think what we really need to do is go, in a way, beyond trying to find cancers that are already there, to trying to figure out who's really at risk for cancer, and then focusing on them and trying to prevent it. So I think imaging, which really, we say early detection is prevention, but it isn't. It's finding cancers that already exist. And wouldn't it be better if they didn't exist in the first place? So techniques that either will look at the breast itself and try to figure out what are the factors that makes it lead to cancer. We're doing a study in China where we have like a Band-Aid you can put on your nipple and collect fluid from your nipple and then test it. And we'll see. I don't know if that's going to work, but that's the kind of thing I think we need to be doing. Cheap, easy, doesn't need a lab or a doctor, can be done around the world, works in young women, and then the women who are positive can go have screening with imaging and anatomic imaging.
Another area that you have been very active in is trying to get people engaged in collaborative research. And research has always been driven from either the academic side of things or from industry and the pharmaceutical industry. Yet our biggest resource in clinical research really comes from the patients themselves. And you've managed to start a variety of grassroots movements. Can you tell us about that approach and how you think it can complement or even augment the current efforts?
I think one of the problems in research is we're not doing enough of it on women. We're doing a lot of it on rats and mice, but it doesn't always translate. And when I talk to scientists, they said, well, we don't know how to find women.
And I said, that I know how to do. So we have the Love Avon Army of Women, where women can sign up, and it's an email list. And we'll send you information about different studies that are going on around the country. And if you fit and you want to participate, you RSVP. We've been in existence now for a little over 2 years, and we've put 44,700 women on studies. Most of the studies, we get everybody they need in a week. And that accelerates the research, it moves things along. The goal is really, for me, is not necessarily the cure. The goal is to find the cause and stop it. And by having women with breast cancer and women who don't have breast cancer that are willing to be in studies, I think we can do it.
And one other topic I wanted to cover with you is at this meeting, for example, most of the poster sessions and most of the oral presentations are about new drugs, which of course are very exciting and scientifically very elegant. However, not a lot of focus is placed on prevention, and that has been obviously and admittedly a very difficult area to study. What are your thoughts on the priorities that we have in terms of therapeutics versus prevention, and what are some of the initiatives in the prevention world that you think are going to pay off?
Well, I think one of the problems is we do focus too much on the cure, and although it would be great to have a cure, all of our treatments have collateral damage. And this past year we lost a great advocate, not to breast cancer, but to a sarcoma caused by the radiation she got from her early breast cancer diagnosed 20 years ago. So you have side effects from chemo, you have side effects from targeted drugs, and wouldn't it be better if we could just stop it altogether? You think about cancer of the cervix, and in 30 years we went from doing total hysterectomies because we didn't know what else to do to having a vaccine. That's great. In breast cancer, how do we prevent it? We cut off normal body parts because we don't know what else to do. So we really need, I think, to look at the lifestyle issues, look at all of the issues that are related, not just to what causes cells to become mutated, but also what eggs them on, because that's the way we're going to control and probably prevent breast cancer once and for all.
Well, thank you again for being with us, Sue. It's always great to chat with you, and thanks to the viewers for listening.